a high dependency limit. On average, we pay about 10,000 shillings. That's what it's $100. Yeah. And at home, we are able to slash this by half. Actually. So that's the quantity around that. Um, and yeah, and the social impact, the creation of jobs. Yeah. Did I get to answer that?
Yeah, I think so.
Okay. Thank you for the opportunity.
Thank you so much, Joyce. Next up is Doctors Live. Pauline, you around? Pauline Gezi, is she here? Oh, okay. I'm being told she's not here. So I will welcome Duncan Montagna from Diabetes Management Medical Center.
In 2013, I lost my dad to diabetes-related complications, what we call congestive heart failure. Before he died, he also suffered two other complications. He got a blind eye on the right, and he was amputated his left leg. So his journey would inspire me to work and teach people about diabetes. My name is Duncan Montagna. I'm the founder of Diabetes Management Medical Center. What problem are we solving? In the world and in Africa, 1 out of 5 people, 54%, work with undiagnosed diabetes. Back at home in Kenya, according to the African Research Population Center, it is estimated that 5.1% of Kenyans, that's about 2.9 million, are living with diabetes. It's also further estimated that 1 out of 2 are undiagnosed. The problem for hypertension is even worse because about 25% of Kenyans, 7.5 million, are hypertensive, and a further 50% adults are pre-hypertensive. What is our solution? I think this is a long slide, but I can go on without the slide. So what solution are we providing? The solution we offer is a fourfold. This is the wrong slide, but it's fine. The solution we offer is fourfold. One, we do what we call preventive care. And in preventive care, through our online platforms, we're able to educate people, offer mobile screening, and all that. The other second thing we do is that we have a patient-centered and multidisciplinary clinic in Ngara, where we focus on offering specialized treatment for diabetes and hypertension, and also we do lab tests. We also have nutrition and all that. The other solution we have is what we call we have a telemedicine platform. It's an e-commerce where members of the public and our patients are able to order for drugs online, and we are able to deliver within 2 hours in Nairobi and outside Nairobi, 12 hours. Our platform is quite easy because we're even integrated WhatsApp. You don't even need to add your drugs to the cart and all that. We've got more than 4,000 drugs on our platform. The final one we do is home care. We have a van that I invested in. So we're able to go and treat patients who are not able to come to our center. So I'm not sure that you got the slide. So I wanted also to talk about our traction. In 2014, as you can see, a year after my dad's death, I started a Facebook page to educate people about diabetes. And this page, as 2020, had grown to more than 100,000 followers. In fact, one of the things that inspired me is that I used to receive a lot of inquiries. People who were thinking that we are in a hospital. So we had to, with a bit of my savings, I had to set up a pharmacy first to take care of it. So the other key, I would say, highlight is that we were licensed to run a hospital, a level 3 medical center. Of course, our specialty is diabetes and hypertension, but we are able to address other problems. Another key, I think, highlight I want to say is that we won a grant, a Van Bellen and Peace Award of $99,000 US, and this is part of the money that helped me invest in our van for medical camps. The other key highlight is that in also 2022, we got accredited to offer services to patients with NHIF, preterm, and KCB insurance. Why this is a big deal? Why this is a big deal is because we initially were only accepting cash. Next. So I haven't seen our revenue or traction, but I just wanted to mention that in our first year of operation in 2020, our revenue was $65,000 US. We more than doubled this. in 2021 to $146,000 US. In 2022, we project to close at around 151,000 US dollars. The team, that is the team led by myself. My background is marketing, and I'm also a diabetes educator. Joy's background is accounting. She's also our general manager. Lillian is my sister and my co-founder. She's background is communication and in charge of our customer service. And we have got 3 doctors in our panel, and Ignatius Obara is our friend and advisor. So what is our ask for today? We are looking to raise $1 million US. This money will help us in the expansion, open 4 more branches, working capital, product diversification, and marketing. On product diversification, we want to build our telemedicine app to be able to consult our patients virtually. This, of course, the money we're looking for is in patient debt or equity. So thank you for listening. Sorry about the mix-up, because I'm pretty sure that this is not the slide I had in mind. But I welcome any questions, and I look forward to working with you to help us put the MMC at the center of excellence in diabetes and hypertension management. Thank you.
Sure. Thank you for the presentation. My question is around competition so far, and who else is in the space that you're in. That's the first one. Then the second, you have mentioned about one center at Ngara. In terms of regional reach, what's your plan, and what do you need, and what are you doing currently?
Okay, thank you. When I look at competition, I would obviously sort of like think of general hospitals. But when you look at developed countries or regions, specialized clinics is the way to go in future. And of course, we have some of them. But most of the ones that we have, or the ones that I've seen, do not really combine in the sense that we do a multidisciplinary center where you're offering ICE services, nutrition, and all that. But also, in terms of our value proposition, we were also lucky because of the work that I've done. We are probably one of the only commercial entities that are able to purchase drugs from what we call Mission for Essential Drugs, and we are able to pass out the affordable cost to our patients. So this, in a way, also is quite helpful. But over and above that, I think the milestone and the milestone we have built over time in growing our community, especially online, has also given us good traction. And also, we have an e-commerce where we are able to deliver drugs. In terms of where we want to go and do, of course, we know what diabetes prevalence looks like. Even probably even central part of Kenya has higher prevalence than Nairobi. So ideally, that's why we're here today, because even a lot of people in our communities want us to take the services we have to them. So this is why we're here. In fact, I wanted to say that out of the $100,000 US sold in my personal savings, we do not have any investor yet for the last 3 years.
Thank you. Could you just touch a little bit more on the revenue model, sort of what the fee structure is, and sort of cost structure for yourself in terms of where the greatest costs come from in your operations?
All right. Obviously, when you're setting up, the greatest cost comes from the investment in equipment, and then later on, things like payroll for now. But overall, when you look at our health sector, the kind of markup is about 33% generally. And of course, in terms of our revenue streams, currently we have a laboratory. In fact, our online pharmacy is our greatest revenue generator, probably 80% of everything we make. We also do nutrition and wellness clinics. We also have now the deliveries for the drugs. We're able to generate revenue. We also have a blog, a subscription blog, where you are able to subscribe and read all the local content when it comes to diabetes and hypertension. It's a blog.mrc. So generally, these are the 4 that we have. But of course, there is more that we could increase, like eye screening. Unfortunately, things like dialysis for kidney failure and such. But right now, we are more like an outpatient center.
I think that's all we can take. This. Okay, please, entrepreneurs, try and make your presentations short so that the judges also have time to take up your questions and answer, so that you can answer them in time. Next up is Peter Mwangi from Advanced Prosthetics and Orthotics Care Center.
Greetings to everyone. My name is Peter Mwangi from Advanced Prostate Care Center. I'm the founder. Sorry, this one again. My name is Peter Njuguna Mwangi from Advanced Prostate Care Center. We are healthcare service providers for the world, specialized in 3D portability in the prostate care industry. Next slide. Who we are, or what we do, is we do 3D scanning, 3D design, and 3D manufacturing and delivery across the country, and the hospitals that we serve and the communities that we serve. Next slide. The problem is that currently 90% of amputees, those are people who are amputated due to pathological reasons or accidental reason. They have the following problems when it comes to prosthetic care: high costs, discomfort and pain, heavy and complex fitting. Next problem. Nasal Solution is a robust 3D platform that is able to do comfort fitting and also increase productivity and consistency when it comes to quality. Next slide. Our new value proposition is our improved productivity and resource flexibility, faster time to comfort, and improved cost to comfort. Our business model is 20% patients, 30% operations, and 50% hospitals. Our roadmap on traction is since 2014 when we were founded, and we started our first local in the city of Nairobi. 2017 is when we started running our first insurance commissions through B2B sales in real estate based in Eldoret. And 2019 we had a mutual partnership between Advanced Technology and an NGO called Global Civic Share International. And in 2020, I think it was our light, and we had MOU signed with the Real Hospital, MOU signed with CrossFit Technologies, which is new review, and also we established a mutual partnership with the ACK Center. 2022, we started our new movement where we're starting to expand our prosthetic care industry into Paralympic sports. Next one. Our 3-action plan actually is to invest in 3D printers so that we increase productivity and expand our markets so that we also increase our revenues. And in 2024, we want to expand our local and international partnership so that we can become the number one potential manufacturer and distributor of prosthetic care in Africa. Next slide. Our computer analysis has shown is that we have a superior product when it comes to cost, design, comfort, and function, beating up our competitors like Autobot Kenya Limited, APK, Kikuyu Mission Hospital, and Kitabe Hospital. Next one. With the team, myself, Peter Mwangi, the founder and chief operations officer. Pauline Teg is our CBI operations, so community-based rehabilitation officer. Freddy Koten is our chief technologist officer. Daisy Kemboi is our content developer, and Sharon Chinengat is our workshop manager. Our business metric shows that from the year 2021 of operations, we're standing at Kenya shillings 3 million of gross revenue. 2022 up to end of October, we're standing at a gross revenue of 2 million. And we're looking to expand the revenues to 9 million and 24 million for the year 2023-2024 respectively, because we will be expanding to 20 more facilities with the potential partnership that we're going to. And that's why we're asking, next slide, for 80 million, 200,000 Kenya shillings. So that for 10% we can invest in 3D software and hardware, 26% product marketing, 16% for technical support, and 10% for the prosthetic companies. Thank you, and the contacts are there. Join me as we seek to explore more market potential together. Thank you. I'll take questions.
Thank you for the presentation. That was very clean.
Thank you.
I just wanted to understand, have you developed any of the prosthetics here in Kenya? And have you used 3D printing before?
Yes. Currently, I'm the ambassador for CrossFit Technologies Limited. As I was showing my introduction, as I already mentioned, 2022, we've identified partnership with Limited Technologies. They're making the leg for us for Paralympics. Also, with CrossFit, since 2016, I was chasing them. To 2020, we've seen the contract together. I've been the brand ambassador when it comes to 3D portability. I'm also the pioneer for 3D prosthetics that is currently being based in Eldoret at St. Luke's Hospital. And the one that initiated that, the Victorian project where we do 3D prosthetics for amputees below the elbow. Due to some, I think, misunderstanding between me and the management, I went up ahead to open another branch in the hospital, now with Boston Technologies. And currently we're doing organic prosthetics whereby we'll be launching next year 3D hardware and softwares based on they'll be based on our community center, the ACK North Trade Rehabilitation Center in Eldoret. So we want to do intensive care whereby we're going to plan with 3 printers in Eldoret, in Real Hospital. Those will be 6 printers, 3 at the ACK, 3 at the Real Hospital. Then what we're going to empower professionals around. The same technology is not just going to give quality, the same technology is going to create mobility. So many professionals are lacking in mobility, and also there's that hardship in starting really a claim physically because of the expense of resources, machines and all that. So 3D printability, you just need a Wi-Fi, you just need a software and a laptop, something called Pandaboard. You have that package and you call it a claim. So you empower them to 3D training, 3D scanning, 3D printing and software creation. Then the printing, we do it because that's where now we get operation. We have a centralized unit of 3D print hardware. We train them, we give them a scan and everything. They scan, they create the socket, they send the file as an NPST file to our center. We produce locally, we deliver them. That's why we talk to manufacturing and
Sorry, just one more. Do you own the design and technology, or have you licensed it from someone and have you registered it in your IP? Do you own any of the design? Have you done the design technology yourself, or have you licensed it from someone? Is it open source?
When you say design,
The design of the prosthetic.
Yeah, design of the prosthetic is a product. That's what we do ourselves. But now the patent of the robust platform is not ours. It's through our external partners.
All right. Thanks, Monkey. Mine would be a quick one. On you mentioned that the benefit to the users, the customers, is more on the comforts and the costs.
Comfort
And
and also time.
yes, and you mentioned quite a number of competitors from that space. What's the uniqueness of what you're doing to ensure that's done? And could anyone come and possibly improve on their products and provide the same?
That brings me to another maybe another we have created another slot due to time, probably flex services. And on that, I'm superior so far when it comes to food profitability and prosthetic care industry. Personally, I've worked with the government. I still work with the government personally. I've worked with private companies, and now I'm a sole creator under my own venture. And one thing I've realized is that there's a very big gap. And I started a long time ago to chase for partnerships with the overseas professionals that were in technology. And like I said, I'm the pioneer, the very first person who got 3D printability at home in Kenya. And right now, looking at the market and in the field where I am, still there's a lot of tension and people are still drifting over the old data technology. And already I'm ahead of them. And the only thing that will beat me is time to only articulate and get ahead of them further than I am right now. Because already in terms of partnership, in terms of technology, I'm ahead of them. So there is no one who is ahead of me in terms of the industry now when it comes to delivery and care. So I think time is the only element that can be against you, and the fact that if I want to articulate it very well, it can cost me. But I have the right partners, I have the right strategy. I've already gone even ahead, spoken to the Kenya Committee of Paralympic Organization at Nairobi. We have seen the date for 2024. We are having trials for Tunisia and Dubai, which will cut off for qualifications for the Paralympic World Paralympics 2024 at Hockey. So we have those in talks. I also have OSHA, which is an American company in prosthetics, working on also still in that date for 2024. So with the 3D printers, we talked about improving productivity and cost. And that means now we can also decentralize clinical care and expand our market so that we can reach more cities and serve them, at least. Sorry.
Next up is Juicy Villgro Africa. Judith Shah.
Hi everyone, my name is Jim Shah. I'm the CEO and co-founder of Zarko Limited. Represented by 3 brands here, which is Villgro Africa, HomeCare 360, and HomeCare 360. When we embarked on this venture in 2018, we wanted to directly impact society for the betterment of livelihoods of individuals. We saw youth unemployment and healthcare accessibility and affordability as the biggest pain points. We premised our base on the Maslow's hierarchy of needs, where every human needs to have these needs to achieve a quality of life. So our vision was to provide quality and affordable care to those who need it while uplifting the livelihoods of the unemployed. Africa has many problems, but the biggest two are Africa will hold 25% of the world population by 2050, of which 10 million will be into the workforce, only 3 million jobs created. The second problem is care. Care industry is the most underinvested and overlooked in the health sector. Africa receives only 1.5% of the global $500 billion health investment. This investment is basically used for infrastructure development such as hospitals or intervention tools such as MRIs or PET scans. Care is never at the focus of investment. This means care is unaffordable and inaccessible. Our solutions are very simple. We have many solutions that target to these 3 solutions. We have our training facilities called Villgro Africa. It's a very innovative curriculum where we use tech and highly skilled labs. We train professional certified caregivers. We also have partnerships with hospitals where we send these caregivers to do hospital internships. Post that, they get certified in their quality. We then send these caregivers into the marketplace to lower the cost of healthcare. Our second solution is home-based care. We employ the certified caregivers into the market and we send them across Kenya to provide home-based care at a lower cost. Our third solution is the biggest solution so far, and our newest solution is the first ever step-down facility in Kenya. It's a short-term care facility where it's an all-in-one billing system, where a patient can use 7 different specialties, bed and meal under one bill. This is our business model. We earn money from training institutes, caregiving services, nursing services, medical equipment, outpatient at home, point of care service at home, and of course our step-down facility service as well. This is our revenue. Missing a lot of things there, but we bootstrapped ourselves from 2018 to 2022 from $0 to $1.3 million as of September 2022. Next slide. This is our traction. So in 2018, we had 19 trained certified caregivers. 2022, we have 1,400 certified caregivers working in the market. We have 3 training institutes across Kenya, and of course, our first step-down facility in Nairobi. Yes, so these 1,400 caregivers are earning approximately $280 a month. 700 clients have been affected by our home care system, and 17 patients have fully used our all-in-one step-down facility so far. This is our team. My name is Jim Chia. I'm a finance grad from Cambridge, Stanford Seed Transformation Candidate for 2023. This is Namila Kandai, our COO. She's an optometrist by profession. And Dr. June Lee, she's a general physician and in charge of medical and non-medical business. We are also 97% women. I'm the women there. We are seeking to raise $350,000 to invest in a very, very new tool by Amazon called Amazon for Health using Alexa. We don't want to create any technology from scratch because it exists already. We want to open 3 additional branches of our training institutes across Kenya. We are going to open our second step-down facility in Mombasa, and of course, onboard human resources to achieve this growth. Why now? We are ready to scale. We have already made the investments ourselves. We have a perfectly and packaged commercialized care company for you to invest in. Thank you.
Any questions?
Thanks. The scale that you've achieved in the last few years is pretty amazing, so congratulations for that.
Thank you.
On the training side, are you registered with any of the medical facility boards, regulatory authorities here? And how are you partnering with anyone to scale that?
So we are certified by the National Ministry of Training Authority of Kenya, the Government of Singapore, and the National Skills and Development Council of India. So we provide 3 certificates to our caregivers, which is valid across 35, 40 countries across the world.
How have you been financed to date?
Sorry?
How have you been financed to date?
Through my own pocket, we bootstrap ourselves, and the business now pays for itself. And it has been paying for itself since 2021.
And what is the growth model? I see you investing in some new technology platforms as well as some sort of physical expansion. Is that like the primary cost for growth, and like what do you anticipate in terms of like how does the investment of 350 relate to revenue growth over this next year?
Good. So we estimate we'll turn over $2 million this year. With this investment, we estimate in a year, because we are set up to scale, so we can open all these branches, onboard the technology, and open a second branch, a step-down facility within 6 to 8 weeks. So the first 18 months, we estimate our revenue to go to $10 million with the investment. Without the investment, it will take us 2.5 years. Thank you, guys.
Next up is Mission Living.
Good morning, everyone. Well, as it loads, I'll introduce myself. My name is Sharon Rago. I'm the founder and managing director of Leisure Living. So at Leisure Living, we provide dietary prescriptions. And let's just move into the market so that you can understand what we're doing. 1 in 3 people suffer every day due to dietary factors, which leads to 11 million deaths every year. Now, the clinical nutrition market is really underrated and underinvested into, and yet it's valued at $64 billion with a compounded annual growth rate of 8%. Now, just let's look into the problem. 90% of patients do not receive medical nutrition therapy, yet they need it. And this is because, firstly, nutritionists cannot recall the nutrients that are required, especially micronutrients required to address diseases while they sit there with the patients. Secondly, the calculations are too complicated for manual calculation. And thirdly, they lack the time. There are 500 patients and you're expected to give out a meal plan and a diet assessment. So what's our solution? We have an evidence-based tool that supports nutrition diagnosis and treatment. Firstly, it has more than 50 disease-specific formulas, and these formulas are actually used to generate clinical nutrition reports like diet assessment and meal plans that are personalized. And thirdly, this tool also encourages diet compliance and patient follow-up, which is a very, very important aspect of dealing with nutrition. Now let's look into the product. The product is a clinical decision-making tool for medical nutrition therapy. Firstly, it generates the nutrition consultation reports, which are personalized and disease-specific for more than 50 health conditions. It automates meal planning. It simplifies the nutrition and diet assessment process. Instead of asking someone, what did you eat yesterday? Okay, yes, ugali and boga and nyama. No, you can actually key in this information and get to know the exact nutrients the person consumes in terms of the macrocalories, the macronutrients, and the micronutrients, and the total energy as well. And what we are also developing is a nutrition chatbot for long-term adherence. And the chatbot is important because a very important aspect of long-term adherence is also understanding about the disease. And for you to understand about the disease, you need to be treated about diabetes. What is diabetes? What we say when we say that actually you need healthy fats or you need healthy sugars. So the chatbot is used for that. So next one, please. Our products, all our products are actually delivered to the client in PDF form to their emails, but also the doctors and nutritionists can access these reports through their platform. Now, if we look into our traction, thank you. If we look into our traction, firstly, our patients have been able to save between 530 shillings and 5,700 shillings per month. Simply because, number one, they're eating the right food, and because they're eating the right food, when they get to the hospital, their medication is reduced. Secondly, we've been able to normalize lipid profiles in between 3 to 6 months. And our diabetes patients, we are having our diabetes patients actually reduce their HbA1c by 4 points in 6 months. Now, in terms of revenue, our estimated revenue for 2022, by the end of 2022, we expect it to be at $200,000. We have 9 partnerships with hospitals and 1 government contract, and a strategic partnership for research with the University of Nairobi, School of Nutrition and Food Technology. Now let's look at our business model. It's very simple. It's a revenue share model where 40% of commission is retained by the hospital, and we charge no upfront cost to the hospital. We bring in the nutritionist and charge every patient 400 shillings per hospital visit. So there's a minimum of 250 patients who come to the hospital per month, and what we have noticed is that per hospital we have an estimated gross profit of 35% after catering for labor and marketing costs. With our government partnerships that we are having, we're charging $1.50 per patient for bulk nutrition consultation services. Thank you. Next one, please. So our go-to-market strategy is very direct. With the enterprise clients, these are all patient aggregators. We use direct sales and sample marketing, and our goal is to partner with 2,000 hospitals by the end of December 2024. For direct clients who are patients and caregivers, we use in-hospital advertising and digital market. Our goal is to treat 1.5 million patients by December 2024. Next one, please. Our competitive advantage. Now, Lisha Living is pioneering medical nutrition therapy in Africa. The thing is that we provide disease-specific and personalized therapy within the hospital, and we support the hospitals to actually create a profit unit inside them. And this is what makes us extremely competitive. Next one, please. And so just to look at our team, my name is Sharon Olago. My background, maybe just to mention, I worked in a USAID project for food security and nutrition, and that's where I got to realize that we are feeding people and making them sick, and this is why I founded the company. We have Tony Onyango, who's a medical microbiologist. He's a great food technologist, and he has worked for EABL. His master's is in medical microbiology from Kenyatta University. And Alex Mugai, who has 6 years experience in developing fintech and agri-tech. Now, in terms of our ask, thank you, please, our ask. We are raising $500,000 pre-seed round on a 10 million cup safe note. And this is meant to help us set up the nutrition clinics, hire our leadership team for scaling this business, because the team we have is actually the team we started the business with. But now we need to scale and scale seriously. We also want to institutionalize administration systems across all partner hospitals and build a large external API nutrition chatbot for hospitals and patients. So I want to invite all of you to join us in making food medicine. Thank you very much.
Thank you for your presentation. How many patients have been treated on the platform?
Okay, as of this year, we've done 3,800 patients, but with a government contract, we're doing 100,000 patients. Yeah.
Just wanted to understand the valuation and how you came up with that. That's the first one. And then the second one is you mentioned 50 data points to come up with your model of your prediction model. How does that work? Is that built internally, or is it licensed, or are you using a third-party white label option?
No. Actually, we have a patent. We applied for full patent, and we have gotten a go-ahead, which we're quite excited about. So now they should be publishing the patent in all the international, because I think they publish that in all the international countries. Sorry, patent bodies in the different countries. So we built it from scratch. It took us 3 years of science as well as building the technology. In terms, second question, please remind me. It was the first one.
I was just wondering how you came up with the valuation.
Okay, so our valuation actually right now is at $33 million, and it was completely, we modeled it based on the hospitals that are in Kenya. We've got 12,385 hospitals. 530 nutritionists are actually in hospitals right now. 33,000 nutritionists are actually unemployed as we speak. So we based it on number one, how we can actually reach hospitals in terms of our reach. All these hospital partnerships we've been able to get over this year. And number two, looking at the pricing. If we were the pricing of 400 shillings per patient. If we were to scale that, but also now get into providing nutrition for health seekers. When we did the valuation, it came to 33 million, but I'm happy to send you that. I don't think I've answered that question right, but I'm happy to send and share it with you. Thank you.
All right, and Sharon, mine is you mentioned that you're the pioneer in this initiative in Africa. With that, then you're looking at Kenya at the moment, and I see the technology being rather the solution being technology based. How do you see this being used elsewhere? And I'm just asking in terms of what you've said, the possibility of it, and having developed it to the intact phase it's in, but then accessible anywhere.
Sorry, could you just go 3 slides down? Down. Down slides, sorry. Not up, down. Yeah, keep on going down. Down. Go down. Backward slides. Okay. Again, yes, there we go. So right now the countries we can serve is actually 26 countries. So how the tool works, it's based on the food composition tables that are available in the countries. Because you see, food, number one, you have to have your nutrition formulas for the diseases. But for you to create a meal plan, you must know the foods that are available in that country. Now, not every country has got a food composition table, but so far we've been able to get food composition tables from 26 countries. So we are able to scale into these countries, and our growth is limited by the availability of a food composition table right now. Thank you.
Thank you so much. I forgot your report.
That's mine.
Okay, so just checking in whether Pauline Haley from Doctor's Lab is here. Okay. You have 5 minutes to present, and then you get 2 minutes for questions from the judges. Just be mindful of time.
All right, good morning, everyone. My name is Pauline Haley. Full screen, I am a co-founder and CCO of Doctors Live, where we provide personalized mental health care for you and yours. Next slide, please. So here we have Winnie and Mark. Winnie and Mark are university students in Nairobi, Kenya. And in 2020, during COVID, their best friend Grace committed suicide. Thereafter, Winnie suffers from depression, anxiety, and Mark uses drugs and alcohol to cope with the loss and grief. They both tried to seek professional care, but they could not find a convenient one, nor one that was affordable in their community. The critical reasons be: over 1 billion people in the world suffer from a mental issue. 116 million are Africans, 85% of which do not have access to effective mental care. It can take over 2 weeks to see a therapist in Africa due to the disproportionate number of practitioners that are available with the ratio of our population. In addition to that, the prevailing stigmas and taboos in society leads to discrimination. This also leads the government to fail to provide affordable care. Doctors Live is transforming mental health care in Kenya and in Africa today. We are providing on-demand mental health care through personalized emotional support via therapy, coaching, and mental wellness content. This is both in the comfort of your home and at an affordable price. And for those without smartphones, we are working on a USSD platform that will provide them and expand their reach in order to access therapy and other mental wellness content. Since we started in March 2022, we have seen that it works. We have registered over 1,282 users on our mobile app. We have generated revenue of over $2,385. We have had over 159 successful therapy sessions and have onboarded 25 plus practitioners with 25 on the waiting list. In order to ensure that we provide quality care, we have partnered with the Kenya Association of Professional Counselors, in order to provide us with accredited practitioners. Now, Doctors Live is always striving to be different and do better. We are not only impacting our clients, but we're also providing more for our therapists and our businesses. For our clients, we are providing access, affordability, and quality care. For our therapists, we are lowering our acquisition rate for them. And for our businesses, we are providing an investment to the employees in order to increase productivity as well as efficient performance in the companies through this mental health care. The total available market is $383.3 billion, while the serviceable available market is $1.8 billion, and the serviceable obtainable market is $500 million. That $500 million is 30% of the Kenyan market that we have calculated that we'll be able to reach, and our demographic is gearing towards the youth. We earn money through commission and subscription of our B2C as well as licensing of our B2B. Now, with regards to our market, Doctors Live is striving to be different and to offer more to our users, and in order to ensure that they are achieving the best experience out of our mobile app. First of all, we are making sure that we are offering our mental wellness content as well as our therapy services in different African languages. In addition to that, as I said, we are working on a USSD platform in order to accommodate those without smartphones for them to be able to access therapy and the mental wellness content. In addition to that, we have incorporated machine learning in order for the users to be best treated and best connected to the best therapist, that is one that is specialized, as well as mental wellness content that will also ensure that their treatment roadmap is secure and it is right for them. In January 2023, we shall be planning to onboard SMEs, corporates, and startups. And by March 2023, we are hoping to support our mental wellness care through insurance coverage. And by September 2023, we shall be expanding to Nigeria, South Africa, Rwanda, and Ghana. Our ask is 500,000 USD, in which we shall be dividing for 30% product development, 40% market sales, and 30% developing consistent wellness pipelines. Our team is a well-versed team that is able to build mental wellness software. We have David Mwambali, the co-founder and CEO, Dominic Tabu, co-founder and CTO, myself, Chief Creative Officer and co-founder, and our Chief Psychologist, Claire Omo. I invite you to join us on our venture in order to inspire and improve the lives of people like Winnie and Mark, to provide them with mental health care that will not only help them grow, but also empower them in their community.
Pauline, thank you for the presentation. Pretty clear, and mental health is critical. My question is around the users being the youth as a focus, and mental care or healthcare being a private issue as well. So as much as it's online with a platform, how do you intend to more on the payment end from youth, assuming the youth goes down to those that parents are the ones who are paying for the services, and at the same time ensuring the privacy that the users require in order to be successful when having an online mental care service?
Alright, so your question is around privacy in terms of one, youth who do want their parents to know, or youth who,
On payment,
yeah.
you have the user, the customer being a youth, someone who the payment will come from someone else.
Yes.
So how is that
Okay.
being, who's a subscriber here? Is it the parent? Is it, just to understand further how it will work? Then that was the first question in terms of users. Then the second one is in terms of the patient now being on an online platform for mental health care.
Right. So in terms of the payment, I think that is clearly optional for the user, but obviously we do accommodate. So as I said, there'll be both commission and subscription. So one in an example where the youth will not want their parents to know, they can just use it directly commission. They can pay through M-Pesa or through card. And if they do want their parents to pay, then they could opt to the subscription, and so that they don't have to, burden them every session, and they can pay for the subscription in order for them to cover the monthly therapy sessions. And in terms of privacy, we have ensured that number one, there is patient-client confidentiality, and that is why we have accredited practitioners and we are partnered with the KPC in order to ensure that that is enhanced. And I wish our software engineer, Dominic, was here, but he's in charge of creating the licenses in order to ensure that confidentiality and privacy is in line with Kenyan law. And so far, we have not had any leakage, and we have ensured that the software is secure.
So for the youth, for a lower youth, who's the patient here? Is it the parent in terms of who's the subscriber on the platform?
It's the youth.
It's the youth.
Just a follow-up question on that. Do you feel that this will be a problem of collecting because the youth here who are under 18 do not have access to, say, a credit card? They might have access to M-Pesa, but are you providing those options? And secondly, if you're focusing on youth and working with corporates, you could have a whole range of people through that. Is that something that you feel will grow faster?
Okay, to answer your first question, actually I'll answer the second one. Definitely, we're not limiting our scope and our markets. We are focusing on youth because that is a prevailing status quo of mental health treatment that is needed in the world and in Kenya today. So we shall not limit. If a parent wants to come and definitely wants to see the therapist, we will not stop them. And your first question, sorry, is in terms of payment, yes? So yes, definitely there is the M-Pesa payment method as well as cards. So those two are already active and working. And in addition to that, we shall be starting to offer insurance coverage by January. So this will also even leverage someone who's not able to pay. So they also have that
advantage. I'll try to make it quick. Just trying to understand more about your reach. How do you get patients? How do they find you? And some of those marketing investments that you're planning to make, like how do those lead to? What are the strategies to grow?
Yeah, that's a good question. So far, as a chief creative officer, I do a lot of social media content. So that's number one, social media. Number two, we have hired our marketing director, who also will be engaging in community-based discussions. So this is active participation, going to the communities and telling them about it. And number three, also going to events. We always have webinars every month, as well as Twitter Spaces. So we try and raise awareness as well as pull our customers as much as possible by diversifying our marketing.
All right, thank you so much. We've come to the end of the session. Someone is trying to talk to me back there. I don't know. But sorry, we've come to the end of the session, and for everyone who's presented now, feel free to take a longer break because we have our next session. It will be an engagement between some other entrepreneurs and potential partners. So feel free to take to go and maybe look around and then come back for our latest session, which starts at 2:30 a.m. So for now, no, sorry, I'm falling. It's 2:30 p.m. So come back at 2:30 p.m. for our final remarks, and of course we get a vote of thanks from Robert. And for now, let's take a 10-minute break and be back for those who are supposed to be in the next session. But thank you so much. This has gone well. We are maybe 10 minutes over time, but I really appreciate your time and your strong presentations. I can recall that the judges had a really hard time just scoring all of you because you have really strong references. So thank you so much. Let's meet at 10 minutes. Oh, I'm told there's tea outside. Let's go get tea for the 10 minutes and then come back as soon as we're done.
Yes, I saw that. Okay.
to school our plans. My iPhone and can like stand around. Okay. It's just that you have to get into the calendar and
Okay, good. Okay, good. Okay, good. Audio. Not being used to it.
you're okay.
So this I continue. I continue.
You're actually very qualified.
Excuse me, guys. Yeah, we need to step out because we're trying to reconfigure the room for the next session. So you can please continue your conversation.
Nikupe kwa laptop yako. Alafu na laptop yako.
Step out.
Please take care of your equipment. We are not going to.
Thank you. But we're going to put them to the side. I don't know whose bags they are. Thanks.
My bad.
Yeah.
Chinese chai anakuja nazo hapa ndani. Oh, okay. So we go outside. Do we have anything else to do?
Yes, you can help to move bags to the side towards the wall. We need one case. Yeah. Thank you.
It has a video. I'm worried. Yeah, because if the video doesn't play, then I've lost everything. So just like have it.
Yeah.
No, this is.
Yeah, but they have to take the Really, this looks like a bag. Okay.
Okay, that bag. That's my bag. Yeah, so somewhere there. Let me see. Yes, a black backpack. Just lift it up. It's a one. It's a one. It's a one. No, it's this one. It's this one here. Thank you.
I hope you're staying with us.
Yes, I will. I just want to go 5 minutes and then I come.
Okay.
Yeah, but I'm here.
You're with us. I actually doubt that we have this whole
How do you want to be reaching?
Yeah, we are
To the city, different direction.
it's going to be like a round robin. We need a show about people standing for the whole hour and a half.
Yeah, he already knows about them.
Okay. 5-minute video down there, then I'm coming back.
Oh, you come with
I just want to sit somewhere and finish.
Oh,
Yes.
all right.
My bad.
Yeah. It's a black laptop. Yeah, I just need water from. Yeah, the water from the basket.
Nice see you. Yeah.
So how are we going to do this time?
Then you bring your banners and after the setup is done, go. Yeah.
banners. Which one is it?
That one. This one, yeah.